A patient tells her nurse that since week 26 of her current pregnancy, she has been experiencing a raised, itchy red rash on her abdomen and chest. This is her first pregnancy. She has never had this before and she has made no other changes in diet, detergents, or lifestyle. Which of the following might describe her condition? A. Urticaria from food allergy. B. Heat rash. C. Pruritic urticarial papules and plaques of pregnancy, PUP. D. Dermatitis herpetiformis. The answer is C. Pruritic urticarial papules and plaques of pregnancy, PUP. The most likely cause of her rash is pruritic urticarial papules and plaques of pregnancy, PUP, a condition affecting about 1 in every 200 pregnancies. While she could be having an allergic reaction, dermatitis herpetiformis or urticaria, or an inflammatory eruption such as heat rash, these are less likely due to their absence before pregnancy and the absence of any significant changes in her diet or lifestyle. How is glomerular filtration rate, GFR, affected during a normal pregnancy? A. Decreases by 15%. B. No change. C. Increases by 15%. D. Increases by 50%. The answer is D. Increases by 50%. In the average normal pregnancy, the GFR increases by upwards of 50%. This correlates with an overall 50% increase in blood plasma volume. The term placenta previa describes which of the following conditions? A. The placenta separates from the uterine wall. B. The placenta develops before the uterine lining is mature. C. The fetus is inferior to the placental position. D. All or part of the placenta is positioned between the fetus and the cervix. The answer is D. All or part of the placenta is positioned between the fetus and the cervix. In placenta previa, the placenta develops in such a way that all or part of it is positioned in the lower 1/3 of the uterus, placing it between the fetus and the cervix. This can cause the placenta to tear and bleed. The most common sign is painless vaginal bleeding in the 3rd trimester, generally after week 32. A 25-year-old female primigravida presents to the clinic for a prenatal visit and is concerned with new onset skin changes she has noticed lately. The nurse caring for this client is aware that there are several skin changes associated with pregnancy. All of the following are skin changes associated with pregnancy except dash. A. Palmar erythema. B. Subclinical jaundice. C. Chloasma gravidarum. D. Heger's sign. E. Linea nigra. The answer is D. Heger's sign. Heger's sign is indicated by a softening of the portion of the uterus between the uterus and a portion of the cervix. The remaining choices are all examples of various skin discolorations commonly associated with pregnancy. The nurse advises a woman with mild preeclampsia to do all of the following except dash. A. Check blood pressure often. B. Limit water intake. C. Weigh herself daily. D. Measure the protein in her urine. E. Keep track of fetal movement. The answer is B. Limit water intake. It is not necessary to limit water intake in women with preeclampsia. It is important that women with preeclampsia drink at least 8 glasses of water per day. The ingestion of water may even help reduce swelling. Checking blood pressure and body weight frequently are important in tracking fluid levels. It is also important to keep track of fetal movement and notify a provider immediately if decrease in movement is noted. Women who are preeclamptic may spill protein into their urine as a result of malfunctioning kidneys.